Intermittent fasting is a common strategy used for weight loss. However, is it safe for everyone? And what are the different ways you can use it? Hi, I'm Dr. Brian Young, a naturopathic doctor in Toronto. Let's take a comprehensive and practical look at intermittent fasting and look at some ways you can use it more effectively. Intermittent fasting is a method of eating which dictates the timing of your meals, so it determines when you can eat, rather than what you can eat. There are a few different timings, however the most popular is the daily 16-hour fast and 8-hour eating window. In this daily 16 and 8 split, you must fast for 16 hours and are allowed to eat only during an 8-hour window. The fasting window cannot be broken up and must be completed as a whole. For example, in the daily 16 and 8 split, if you decide to stop eating after dinner at 8 p.m., a 16-hour fast means that the next time you could eat something would be a full 16 hours later, or 12 p.m. noon the next day. You cannot start your fast at 8 p.m., then stop your fast at 9 a.m. the next morning to eat breakfast and resume the fast again afterwards. The fasting period must be completed in one solid chunk. Other splits exist as well. For example, the more extreme 20 and 4 split, which has you fasting for 20 hours every day, or the less extreme 12 and 12 split, which has you fast for only 12 hours a day. More extreme splits are expected to improve its effectiveness for weight loss, but may not be appropriate for everyone due to their extreme nature. Also, dietary regimens that are too extreme may increase the risk of yo-yo dieting, as they tend to be less sustainable for the long term. Another method of intermittent fasting involves fasting for a full day, so that's a solid 24 hours for a few times a week. For example, if you finish dinner at 8 p.m., you would fast for 24 hours, then the next time you could eat would be dinner 8 p.m. the next day. And you would do this maybe 2 to 3 times a week rather than daily, as seen in the 16 and 8 split. The fasting days can be broken up into the week, like doing it Monday and Thursday, or doing it every other day, but each 24-hour period cannot be broken up. Yet another less extreme method involves consuming a very low-calorie diet for 2 days a week, then eating like normal for 5 days. So instead of a complete fast, 2 days of the week would consist of a diet with around 500 to 600 kilocalories per day, and the remaining 5 days would be like normal. Again, the 2 days can be broken up into the week, but each 24-hour period cannot be broken up. How does it work? Intermittent fasting helps control the timing of when you eat, limiting it to a certain time window. Usually, this helps reduce the overall amount of food consumed per week. However, the fasting period also has beneficial effects on the body. It increases insulin sensitivity and lowers levels of insulin, making the body much more effective at controlling blood sugar. It also helps prevent the body from storing fat, since high insulin levels tend to do just that. It also increases levels of human growth hormone, or HGH, in the body, helping the body to build more lean muscle. HGH also helps improve metabolism and burn fat and sugar more effectively. Fasting may also reduce inflammation in the body and slow inflammatory processes that lead to unwanted pain, swelling, and those related to obesity. It may also help reduce bad fat levels and help reduce the risk of cardiovascular disease. There's also some interesting research surrounding fasting helping repair cellular damage or slow aging. So, the fasting state may impart some beneficial effects to those trying to lose weight in addition to reducing their calorie intake. What can you eat? During the fasting period, you generally cannot have any solid foods. Liquids with any significant amount of calories like smoothies, juice, milk, or soups are usually not allowed during the fast as well. You can have water, sparkling water, tea, coffee with no milk or sugar. Some sources suggest that you can consume up to 50 kilocalories of food without breaking a fast, with some people allowing for a small 50 kilocalorie snack, juice, or soup while fasting. However, my recommendation is to just aim for no calories and stick with water, tea, and coffee. Eating even a small 50 kilocalorie snack could awaken your digestive system and just end up stimulating more hunger during your fast, making it more difficult to complete. I mean, If you're a medicated diabetic and need a small 50 kilocalorie snack to prevent low blood sugar while fasting, that's totally fine. Although, I would recommend working with your doctor to change and lower your medication doses to prevent low blood sugar in the future. Side effects. Generally, intermittent fasting is quite safe when done properly. Most side effects surround getting used to dealing with temporary hunger or changes in energy and mood, especially if you've never done intermittent fasting before. You'll feel a little hungry, a little tired, and maybe a little moody or cranky at first as your body gets used to it. If you've never fasted before, your body is likely used to eating whenever it wants, deciding when it wants to be fed, and taking back this control will be a big part of the challenges you face when implementing intermittent fasting. For example, if you're used to eating breakfast and suddenly decide to skip it to adhere to the daily 16 and 8 split, you'll likely find that your body will feel quite hungry in the mornings for a while. This is because breakfast has always been a part of your routine, and your body expects it. So every morning, it prepares itself to receive food, and if it doesn't, it makes you feel very uncomfortable about it. However, once you've skipped breakfast for a while, the hunger will slowly go away once your body realizes it doesn't need to prepare for breakfast anymore, since you're no longer feeding it then. Once it gets used to this new routine, it should stop giving you problems. Risks. Intermittent fasting may create some concerns around medicated diabetics, those on blood pressure meds, fertility and pregnancy, or those with eating disorders. In diabetics, taking medication like insulin while fasting can cause hypoglycemia since insulin lowers your blood sugar. And if you're already not eating anything, it could drop way too low. You'll need to work closely with your doctor to reduce your insulin dose if you want to safely intermittent fast during your diet. If you're on blood pressure medication, intermittent fasting may lower your blood pressure enough to cause low blood pressure problems. Again, you'll need to work with your doctor to lower your blood pressure meds safely during your fasts. Intermittent fasting may also affect fertility, like causing irregular menstrual cycles in women or causing issues with producing breast milk, especially in women who have nutritional deficiencies to begin with or undergo a more extreme fast. Finally, if you have an eating disorder, talk to your doctor first about how to implement it safely. Should you do it? I definitely think it's a strategy worth seriously implementing into your weight loss protocol. However, there are a few things you should keep in mind. Firstly, it's important to remember that intermittent fasting for weight loss relies heavily on making sure the overall amount of food consumed per week is lower than without intermittent fasting. Things that may make intermittent fasting ineffective is if you have problems with compensatory overeating, or tend to overeat when you're finally allowed to eat. For example, if you fast for 16 hours in the day, but spend the remaining 8 hours binging, snacking, and gorging yourself, you might end up eating more calories per day than if you had not intermittent fasted at all. You need to make sure you control compensatory overeating and avoid rewarding yourself with food for completing a fast. Implement intermittent fasting as a part of how you normally eat, not short periods of dietary punishment to force weight loss. Secondly, I recommend you also have a good dietary weight loss plan to go along with it. Don't just do it in isolation, allowing yourself to eat whatever you want. The combination of both a good weight loss diet and intermittent fasting is a very powerful combination, working better together than the sum of their individual parts. Thirdly, if you're taking medications for blood pressure or diabetes, make sure you work with your doctor to prevent low blood pressure or low blood sugar problems while you intermittently fast. If applied properly, it can be used safely and effectively in diabetics to control blood sugar in addition to losing weight. Finally, if you're a woman trying to become pregnant or currently breastfeeding, know that fasting can cause problems for you. I recommend not fasting during those times and then resuming once it's safe to do so. Let me know in the comments down below about your experiences with intermittent fasting. And if you found this video helpful, please leave me a like. As before, I'm Dr. Brian Young, bringing you weight loss info on this channel. Subscribe and hit the notification bell if you're interested in learning more, and share it with someone you know can use the help.